Okay, it's a pleasure to have the wonderful Dr. Theoharis Theoharides on with us today. Welcome. Dr. Theo is professor at the NSU Institute of Neuro-Immune Medicine and director of the Center of Excellence on Neuroinflammation Research at the Clearwater campus. He is in the world's top 2% of most cited authors and is a top-rated expert on mast cells. Today, we will be discussing the connection between interstitial cystitis, a chronic pelvic pain condition that is becoming significantly more prevalent, and vulvodynia, a type of long-term pain or discomfort around the outer part of the female genitalia called the vulva. So welcome, Dr. Theo. Thanks so much for being here today.
Oh my goodness, it's a real pleasure, and I'm congratulate you again for the wonderful work you're doing to get the message across for
Oh, well,
all of
thank
these
you.
very difficult and painful conditions.
Yes, and I'm really excited to dive into discussing, the correlation between these two conditions today, IC and vulvodynia, because I think a lot of people aren't aware of how many people do struggle with both. So maybe we can just start off by you explaining the potential connection between the two.
Sure. For a long time, interstitial cystitis was defined by pressure in the lower abdomen, not so much pain, and of course frequency and nocturia. Uh, and Pain was quite often mentioned by patients. And the pain could be, in addition to pressure, again, the lower abdomen, it could be pain on intercourse or after intercourse, but also pain around the area you described. And in fact, a number of my colleagues, especially Christine Whitmore in Pennsylvania, would do like the Q-tip test. So you would just touch with a Q-tip and people would feel pain. So clearly the sensory nerves in the area were sensitized, but many of the nerves that carry these messages are part of bundle of nerves that also innervate the bladder. So after a few years, the word bladder pain syndrome was added after forward slash to indicate that, yes, that's part of the presentation. Now my colleagues, the urologists, are sort of going back again and trying to separate the two conditions because probably about 30 to 40% of the people complain of pain, but the others do not. So the question was, well, if I don't hurt, then why do you call it bladder pain syndrome? So you see how things are evolving. But be it as it may, there was no question that good number of patients with interstitial cystitis have vulvodynia, which would be pain for whatever reason, and we will discuss that, or they might have what we call vestibulitis, which basically describes potential inflammation rather than the symptom, but it's associated with pain anyhow. So, as we well know, there aren't really effective drugs for interstitial cystitis, except for the dietary supplement CystoProtek that has been used fairly effectively over the years. And there hasn't been any medication for vulvodynia, unfortunately. So, we've learned over the years, before we go into details, is those individuals that have had interstitial cystitis and vulvodynia, when their interstitial cystitis was calming down, so did the vulvodynia, even though they didn't go exactly hand to hand, but there's no doubt that we're doing better. So then the question arose, is vulvodynia a condition in its own right, so to speak? And recent papers, and I reviewed the papers just today, there aren't that many, but they basically highlight the following three take-home messages, if you wish. Number one, many of the individuals with vulvodynia have other, let's call them neuroinflammatory problems, and I'll discuss that, or conditions that fall within that group. So some epidemiological studies have shown that such individuals are more likely to have chronic fatigue syndrome. We call it myalgic encephalomyelitis, chronic fatigue syndrome, or they might have fibromyalgia, or interestingly, and we will discuss this even further, have allergic-like problems. And I put the allergic-like in quotation marks because they may not be true allergies, but they still involve the type of cell that is important for allergies called the mast cell, M-A-S-T cell. So one take-home message, there are comorbidities. Second message is that the mast cells are involved. And in fact, two papers showed that there was accumulation of mast cells in that area. And the third set of papers had to do with inflammation in the area. Now, inflammation could be allergic inflammation, or it could be inflammation due to any other set of triggers, and there are many such triggers. And many individuals might have inflammation because of what we call exposure to. It could be exposure to, let's say, food antigens. Sometimes we might call it food intolerance, not food allergy, and I'll explain the difference. Or there might be triggers from other sources. There might be a trigger, for instance, from the underwear someone is wearing. And there might be a trigger because they might have vaginitis. Some of the fluids might actually be affecting the outside of the vagina. There might be infection in the vagina, and over time might cause actually problems sort of on the outside. And interestingly enough, although there isn't much other than anecdotal reports on this, one could be allergic to what their partner might have eaten. So let's say you're allergic to peanuts and your partner might have eaten peanuts before intercourse, and now you have intercourse, and all of a sudden you have horrible problems. And that's because some of the seminal fluids carry the antigen, the peanut antigen, and your vagina or the vulvar area was exposed to it. So it's important when we take, let's say, medical history, or when we discuss with friends or others, to make sure that we ask such questions, because they might help us understand and potentially come up with treatment approaches that we would never thought of if we just focused only on the vulvar area. Let me
Mhm.
stop there in case you have some questions. We
Well,
can
it's
go on.
I mean, a lot of people do take an antihistamine, right? Like an Atarax or whatnot, and that can help a lot of people who have interstitial cysts, you know, alleviate
That
some of the
that is that
symptoms.
is true. So here is an example of something entirely relevant. A paper was published in the journal Nature 2 years ago, and an editorial was then published in the New England Journal of Medicine. How eating a certain food substance can cause abdominal pain, and the caricature nicely showed that molecules, of which histamine was one, released from gastrointestinal mast cells activated by food allergens, could sensitize or trigger sensory nerve endings or nerves in the obviously intestinal but also abdominal area that is perceived in the brain as abdominal pain. It's like when children have allergies to milk and they get colicky pain.
Hmm.
That's pretty much it. But now, consider that the bladder is definitely filled with mast cells. We published this and so did others. In fact, the European Urologic Association counts on biopsies the number of mast cells as a subgroup of interstitial cystitis patients. And now there are reports that the vulvar area has a lot of mast cells. So imagine the same thing, that now you have the mast cells in the vulvar area or the bladder area. They're exposed to a particular either antigen or other trigger. They release molecules that sensitize the nerve endings, and now you get chronic pain in that area as well. So I think that processes are quite similar. And we might have time to talk about the fact that stress, whether it's physical or mental stress,
Hmm.
worsens these conditions, because we were among the first to show that the first hormone released under stress, that we thought it was released only in the brain, but now we showed that it was released also in the bladder area, called corticotropin releasing factor, CRF or CRH, that stimulates the mast cells on its own without any allergen, and also resets the reactivity to additional allergens, make things worse. So you see how it becomes a cyclic sort of process feeding on itself.
So then, would you say that it's probably wise for every IC or vulvodynia or both patients to go for, allergy testing to determine what could be triggering their
I
response?
think it would be very useful, but many individuals who suffer turn out to be negative on allergy testing. Why? The allergy testing, whether we do it in the blood or the skin, depends on the presence of specific immunoglobulin E, we call them IgE, antibodies to the particular antigen. If you don't have those, the mast cells will not fire.
Mm.
But if you do have them, then obviously you're allergic to those substances. But when we do the test, we have to identify what we're looking for. It's not like you do a test and all of a sudden it will tell you you're allergic to X, Y, and Z. So we'll have to ask, for instance, and check off, let's say dust or dust mites or grass or mold species or casein in milk or gluten in bread, etc. Okay? And you can keep on going, but you have to specify the provider what you want to check for.
Mhm.
And if you are allergic, then clearly you have to avoid those and do some desensitization. However, about 40, maybe even 50% of the people that have sensitivities, especially food sensitivities, are not allergic. And those tests measure the immunoglobulin G subclass of 4, IgG4.
Mhm.
And then we call that food sensitivity test. Many of my colleagues in the allergy domain don't like food sensitivity testing because if you eat something every day, it will turn out false positive.
Right.
So I always tell families, patients, whatever, if you can tolerate about 3 days of just boiled chicken and quinoa or something like that, then
Mhm.
do it and then do the test.
Right.
And the reason being, quinoa doesn't have gluten. Very few people are allergic that I know of sensitive to quinoa, and is few also to just chicken.
Mhm.
Now, one allergen that has been creeping up over the last few years, and we absolutely have to be looking for it, is abbreviated alpha gal, G-A-L. So alpha like the Greek letter alpha.
Mhm.
So alpha gal is present in mammals, especially in red meat, obviously mammals, so beef, pork, etc.
Mhm.
And it's become a major problem because for those individuals who have been bitten by a tick, because the tick might feed, let's say, on a deer or squirrel or cow or whatever, and now it might bite you. And even though it might not cause Lyme disease or some other disease like Borrelia, which is Lyme, or Babesia, which is also carried by tick, it can carry the antigen, and now you're sensitized to the antigen. So now you eat meat, and you might not know it, but you will react to the alpha gal antigen. And because gelatin is very prevalent in many cosmetics, drugs, supplements, etc., you might react to those without knowing that it is actually the alpha gal in the gelatin that may be used. And many times we might see redness around the face, for instance, where someone using chopstick or lipstick that
Mhm.
has, that. So I always like to ask for alpha gal sensitivity, and that is part of the IG testing that I mentioned earlier.
Mhm.
There are some companies, there's a company called Pinner Test, Pinner in New York, as others, that can send you a kit basically. You can just prick your finger, just like testing sugar, and
Mhm.
send it to them. And they do 250 different antigens, unlike the IG, where you have to specifically ask for one antigen at a time. So I think it's very important because other colleagues like Dr. Rob Moldwin in New York published a few years ago that many individuals with interstitial cystitis, he wasn't talking Vulvodynia at the time, did react to a number of foods.
Mhm.
So he was among the first to actually say what we were saying for many years vis-a-vis the mast cells. Now he specifically said it for foods. So allergy testing, food intolerance testing,
Mhm.
and in addition, what we call histamine-rich foods. Because in addition to food insensitivities and food allergies, we have histamine intolerance.
Mhm.
Histamine comes from the mast cells, but also comes from foods. And we need at least one enzyme to break down histamine, and that's called diamine oxidase. So one can do genetic analysis for the enzyme and the enzyme might have mutations, it might not be working very well, in which case one can give diamine oxidase supplements about 50 minutes before food. And the foods that are notoriously rich in histamine would be ripe avocado, ripe tomato, spinach, eggplant, cheeses, of course, sardines, and literally all spices, including cumin.
Hmm.
And I said including cumin because there's some supplements in the market that are supposed to be antihistamine and they
Mhm.
contain cumin in them. Why they
Right.
contain cumin, God only knows. But so these are the we should start actually letting people know that all of these could either trigger or sensitize the mast cells, and then the mast cells release molecules that sensitize the nerve endings. So
Mhm.
let's get kind of as close to the source as possible before we start treating whatever the treatment would be for vulvodynia.
Mhm.
Um, and because so many molecules are released over and beyond histamine, antihistamines alone are not enough. So, for instance, we published a paper, and I'll put it in the chat a little later, that low dose naltrexone may be very helpful for chronic pain. So, naltrexone, as you may know, is a blocker of the receptors for opioids like morphine, and we use it for opioid overdose. But there, the amount is 100 times more than what we're talking about. So we're talking about 0.1 milligram a day, up to about 4 milligrams a day. But it seems to desensitize basically the nerves or decrease the firing of the mast cells. But where nothing helps, that seems to help. To give you an example of what we try to do. There's also something very cheap, and if tolerated, could be effective. There's something called solar cane that we use sometimes, after we got burned in the sun or whatever. So
Mhm.
the solar, of course, because we use it, during the summertime, the cane part is from a local anesthetic. So local anesthetics like benzocaine. Okay, so it's got a little local anesthetic. It's got aloe and some cucumber, and that's why it's kind of green, but it's very refreshing. And if tolerated, it could take the edge off because it's a local anesthetic. It doesn't treat the problem, but it reduces, the pain, etc.
And you have a product as well, Gentle Derm, that
Correct.
is.
So we have a product that, if tolerated, can be used and could be very helpful. And it contains aloe and then extracts from honey, oregano, uh, and citrus fruit.
Mhm.
And the extracts are actually purified. So when we say extract, it's like 98% pure material added to the lotion. But you never know what individuals might be sensitive to one or the other ingredients. So if one can tolerate it, you can certainly use it. And it could be quite helpful because it has tetramethoxyluteolin that blocks inflammation, blocks the mast cells. To avoid the possibility that some might not tolerate it, we're trying to come up with a new lotion now that will have the tetramethoxyluteolin, which is the anti-inflammatory component,
Mhm.
but in a base of only one ingredient to make it a lotion to avoid the other possibilities of people not tolerating it. And there's one colleague who is ready actually to test it on a number of vulvodynia patients, but probably will not be ready for another month or so.
Okay.
If that works, then clearly the company Algoner will make it available kind of right away. And
That's
we're trying to
great.
come up with a good name for it. So if you have a good name in your
Yeah.
mind, please let us know.
Let me have a think.
Yeah.
Yeah.
So,
So how do
uh,
healthcare providers typically approach managing patients that have, both conditions?
well, first of all, you've got to get through the door to a provider who will listen to you. And as we all know, many providers don't. They don't even believe that interstitial cystitis
Mhm.
is a real problem. So identifying the physicians who deal with such problems is the first step. Unfortunately, there aren't that many, but there's some good ones. So I don't want to mention the name, so I will not sound like, um, you know,
Right.
favoring one over the other, but there are
Mhm,
about, at least 5 of them around the country that are pretty good.
mhm,
Um, then it's a matter of having them understand what the triggers might be, because otherwise you'll just be dealing with the sensory problem and the pain without necessarily going to the bottom of it. But I think before you reach out to someone to help you, if someone were to follow what we've been discussing, there will be, a third of the way there. In other words, avoid what we call pro-inflammatory foods, and you can find such on the internet and in various magazines. Avoid histamine-rich foods. Avoid conditions, let's call it that way, that are likely uh, to cause a problem. So don't wear tight underwear because just the pressure can cause problems.
mhm,
Don't wear scented underwear because the smell, even though it might not be direct, might trigger your brain to trigger basically sensory nerves in that area. So go as blunt as it can be. I always say it's like what we do for newborn children. The least offensive shampoo, the least offensive, perfume or soap.
mhm,
I would imagine that many people, especially women, might want a scented soap, but many times the scent can cause a problem. So be as blunt as you can be. Olive oil based soap.
mhm,
Hardly anybody reacts to olive oil that I know of, but that. Um, and then add whatever is likely to reduce the problems. So an antihistamine would be great if you can tolerate it because there is histamine involved. Uh, Using some of the supplements that block the mast cells from firing. So Neuroprotek is one, both in capsules as well as in liquid, with a dropper. Or if you cannot tolerate many components, just pure lute, which is only luteolin in small capsules, in conjunction with the gentle derm that you kindly mentioned.
mhm,
All of those you can do on your own. Then you need a physician to really move on to potential medications. So as I said, low dose naltrexone would be one approach. Some of the old tricyclic antidepressants that have also been used in interstitial cystitis may be helpful because they're good for chronic pain, such as, for instance, amitriptyline, Elavil. But the smaller doses that we give for depression. So with depression, one might give 75 to 100 milligrams a day. For what we're talking about, 25 milligrams or even less might be sufficient.
mhm,
There's also a skin lotion that contains one such old uh, antidepressant called doxepin.
mm,
So doxepin is the antidepressant, but there's a skin lotion, I think it's still in the market, that contains doxepin in a skin lotion. So that might reduce sensitivity of the nerves uh, uh, locally. And then finally, one could use drugs that have been used for diffuse, we call it neuropathic pain. Such would be Neurontin, and so that's gabapentin. Another one is pregabalin or Lyrica. Yeah. I tend to like, if we get to that point, to start with Neurontin or gabapentin because it comes as 200 milligrams and you can slowly increase it up to 1200 milligrams a day. Gabapentin has two or three denominations only. So you can start with that too. And if that helps you, that's great. Um, so there's a lot of hope as we move on, but clearly, potentially using something locally would be easier, if you wish, or important, I should say.
And how does CystoProtek help? I mean, we're talking about, conventional medications, but CystoProtek being a supplement, how could that
Sure.
sort of, take the place of many of these conventional
Well,
medications?
it would, because CystoProtek, first of all, has both chondroitin and hyaluronate
Mhm,
that are the natural ingredients that make up the wall of the bladder. So vis-a-vis the interstitial cystitis part, since there is sterile inflammation in the bladder, those help replenish basically the bladder lining.
mhm,
They also contain or it also contains quercetin, and that is an anti-inflammatory flavonoid, so that will reduce the inflammation. And the good thing with the CystoProtek is not only that it contains all of these, but they're in capsules where the 50% of the capsule is olive oil, and that allows 3 to 5 times higher absorption from the intestine. So they're literally liposomal in nature. Since the introduction of CystoProtek, which was almost 20 years ago and is still going, we've shown that another molecule called luteolin is even more potent than quercetin. And if you give them together, there's synergism. So in NeuroProtek, they're two together. But if one is taking CystoProtek, you're getting the quercetin, then you can get pure lute that's only luteolin to basically allow synergism between the quercetin that is found in the CystoProtek and the luteolin in the pure lute. And then you can give, as I said, some antihistamine on top of it and use, to the extent tolerated, the gentle derm.
Mhm.
Around February, Algonaut is going to have a new supplement, and it's going to be called Allergy Protect. So it will have basically 4 ingredients getting to the allergy part in different ways. So it will have a molecule that is even more potent than luteolin
Mhm.
in it, natural molecule, that will be blocking the mast cells. It will contain a natural molecule that has antihistaminic properties. It's like getting an antihistamine, but you don't have to be giving a drug. And it will have a molecule that helps break down histamine once it's been released. So we'll have basically 3 different ingredients. And it will not have to be necessarily in olive oil because those ingredients are partially water soluble. So it will be for the first time in vegetarian, basically capsules. So we will avoid gelatin as well. That obviously comes from a mammalian source.
And this would be a product that you would find IC patients would benefit from?
I think they will be enormously helped, especially those that might have either sensitivities to
Hypertension.
foods or allergies to various foods or other molecules, what have you. And in
Mhm.
a sense, it will be helpful because these combination of molecules would be much better than the quercetin that is found in CystoProtek. So the advice would be that you take the CystoProtek and the Allergy Protect together,
Mhm.
and that will cause much more synergistic beneficial actions than either one alone.
Wow.
So
And the
let's.
beauty is you can sort of, stop taking conventional medication, which is great because a lot of people,
I don't want to say that conventional medication might never be useful because there are individuals, as you know, that have Hannah's ulcers.
Sure.
Those are much more painful. They're much more difficult to treat. Sometimes colleagues have to go in and burn them with a laser beam.
Mhm.
Um, so, but at the end of the day, you still need to replenish the bladder lining, etc.
Sure.
So even if you were to have Hannah's ulcers, you still benefit from everything we discussed, except that if the ulcers are plentiful, you really might have to go in and get rid of them before you allow everything else to help you recover.
Mhm. And you mentioned a lot of, antidepressants. Is there anything in CystoProtek or Allergy Protect that kind of can replace or sort of, act in that realm?
Um, Not for the depression part. The
Mhm.
antidepressants have 3 actions, actually, the old antidepressants.
Mhm.
And by old, I
Trifecta.
mean not the Prozacs of the work, older drugs.
Mhm.
So they're obviously antidepressants in their own right,
Mhm.
but number 2, they're antihistaminic.
Mhm.
So you might not need an antihistamine, okay? And they're slightly anticholinergic. What does
Mhm.
that mean? So in order for the bladder to urinate, the detrusor muscle must contract and the sphincter has to open up. And that happens through the neurotransmitter acetylcholine.
Mhm.
So if we were to give something that is anticholinergic, we will basically keep you from doing that. We can't give too much of that because you might put you into retention, which is the other extreme. So
Mhm.
that's why I always say too much of something is not necessarily good. But that's why some of those tricyclic antidepressants are useful. And doxepin that I mentioned is one of them.
Mhm.
So with doxepin, you can get the antidepressing part, you can get the anticholinergic, you get a little antihistaminic, and as I said, it exists in a cream as well. The cream is called, used to be called Zone. I forgot what it's called now. I'll look it up. But
Yeah.
anyhow, that's one of the better antidepressants if one were to use, um, you know, some antidepressant. The
Mhm.
the difficulty with the antidepressants, the older ones, is that they are somewhat sedating.
Mhm.
Um, and in addition, they may also uh, increase appetite.
Right.
So, for certain individuals, it might not be the best. Actually, the cream is called Zonalon, Zonalon, and it's still available.
Okay.
So if anybody with a chronic problem is likely to be depressed. I mean, why wouldn't they?
Sure.
So from that point of view, giving maybe 25 milligrams of doxepin
Mhm.
and maybe using the doxepin cream Zonalon might be a nice combination if one has to get to drugs.
Mhm.
And most of my colleagues don't even know about doxepin or the cream.
Mhm.
So we should be educating everybody about it.
Yeah. I'm glad you have so much knowledge and you can share this with everyone because,
Thank you.
we don't have a lot
Thank
of
you.
doctors like you who do this.
Thank you very much. But remember, we spoke about stress. We really don't have, good ways to eliminate stress without using drugs, unfortunately.
Mhm.
And obviously, the so-called benzodiazepines,
Mhm.
um, like Valium category or Xanax, etc.,
Mhm.
are fairly safe, but eventually they do cause psychological addiction. It's not addiction like morphine addiction, and then you end up getting needing a little more, etc. So for a short period of time, I think they should be used
Sure.
for conditions like the ones we're talking about. But there is a herb called ashwagandha.
Mhm.
It's spelled kind of funny, but it's pronounced that way, that I find very useful.
Mhm.
It takes the edge off. I've recommended it to children as young as 4 years old that might have a lot of anxiety, social fears, etc. And you can go from 100 milligrams to 500 milligrams a day with that. So I would recommend that because there's always anxiety with conditions like this. It's like a migraineur who kind of knows the migraine is about to come on, and you're scared
Mhm.
out of your mind because you know it's going to hurt.
For sure.
So many times, patients will feel the need to avoid something that is likely to cause the problems,
Mhm.
and just the anxiety alone is going to trigger them.
Mhm.
So we need to take care of the anxiety. Or you can use, of course, yoga or whatever else one might use
Mhm.
to. But I think anxiety is a major problem in all of these comorbidities: chronic fatigue syndrome, fibromyalgia, allergies. We published many times reviews how stress worsens allergies.
Mhm.
I mean, I had a patient with eczema. His eczema was very quiet. He was in the stock market. Every time the stock market will plummet, he'll be covered with eczema. The
Mhm.
market will go up and he'll be, happily and oblivious of the problem because his skin was clear. So we know that stress can worsen things.
Oh,
And
absolutely.
we can, unfortunately, there's political stress, there's economic stress, there's, physical stress, there's all kind of stressors, and we can't deal with all of them. But if we can actually allow some time a day to sort of try to calm down, take some deep breaths, a little ashwagandha, it will go a long way.
Mindfulness for sure.
Yeah, mindfulness. That's right.
Yeah, it's definitely
Um,
beneficial, and everybody could use it, even people who don't struggle with these, chronic conditions.
absolutely, everybody can use it. Or a little classical music, just whatever will basically put you in a different state for a bit. We need that.
Absolutely. Are there any case studies you can share where you've seen success, of management of ICN vulvodynia?
Absolutely, yes. So one of many success stories is actually now on the Algonet website
Mhm,
and on my personal website, drtheoharides.com. It was a lady in Greece. Her presentation is with subtitles in English now, so everybody can read it. But
mhm,
she was suffering since she was 18 years old
mhm,
with everything that we've been discussing today. So a lot of bladder pain, frequency, in and out physicians, lots of antibiotics. Antibiotics, of course, kill all the good bacteria, and then you start chasing your tail.
mhm,
And she started basically on pretty much what we discussed. I will not go over them again. Within a month, everything had disappeared.
mhm,
And as she describes herself, she's back in her job, etc. There's another lady who I'm waiting for a small video to arrive from Denmark, who had suffered so much for almost 15 years. Her family had fallen apart. She lost her job, etc. Within a month and a half to 2 months, I forgot what it was, she actually was back in her job and got a promotion on top of it.
Wow.
And some of the testing is difficult to do in certain countries. And of course, as I said earlier, we don't have good testing for these conditions anyhow. But
Yeah.
even the testing for the allergies that we were talking about, etc., there are molecules that we can measure in the urine. If someone has mast cell activation problems, and I'll talk a little bit about this in a second, we measure the breakdown products of histamine. It's methylhistamine, or we call it N-methylhistamine, the break products of prostaglandins, which are released from mast cells. So if those are high in 24-hour urine, then we know that someone has mast cell activation, and the activation could be due to allergies, it could be to other things. That's why we tend to use the mast cell activation disorders now as a bigger umbrella than either allergies or sensitivities. And if such individuals have high levels in their blood of an enzyme called tryptase, which comes only from mast cells, then we call it mast cell activation syndrome. A
Mhm,
lot of people now use the word MCAT, mast cell activation syndrome, uh, but not everybody has high tryptase. So that's why I tend to say mast cell activation disorders,
mhm,
of which mast cell activation syndrome is one if tryptase is elevated, because many other conditions, tryptase is not elevated. So those urine metabolites, let's call them, are not measured typically in most laboratories. Even in the States, it's difficult to measure them.
mhm,
So there's a laboratory in Athens, Greece, and another one in the country Cyprus.
mhm.
So I tell patients, look, you need some vacation. You need to relax. Just go away. Go to Athens, Greece, when the weather is nice, or Cyprus.
Okay.
You can go to that lab. I'll give you a prescription. They do all the testing, and then you can go back. And I have many patients who have done that from England, from Denmark, from Finland, for instance, because they need the sun. And by the way, vitamin D is also anti-inflammatory in addition to how good it is for your bones. And I found many individuals to be lacking vitamin D3, and I actually recommend that we replenish it. I forgot to mention this earlier. So if patients find it difficult, whether it's Canada, the United States, wherever, we can make arrangements. They can fly to Greece, have a little vacation, get the testing done, and they'll have all the results.
Hmm,
Um,
that's
so,
lovely.
um, yeah, we're trying. I've been trying for a couple of years at least to create a center for complex diseases on the island of Cyprus, because there's like 9 months to 11 months of sunshine there. But unfortunately, with everything happening in the Middle East these days between,
Mhm,
Palestinians and Israelis and Syrians and Turkey, that's not the best time to be doing this. But hopefully things will calm down, and maybe in a couple of years there might be a nice such center where everything can be done on the spot.
Mm.
So the idea would be you have physicians who know what you're talking about. They can make the diagnosis. We can take blood or urine, stay there for 10 days, and by 10 days we'll have all the results and recommendations, and off you go.
Mm.
So we're going to call it the whole health resort.
I love it.
Okay.
Sign me up.
There you go.
Yeah. Oh,
Yeah.
wow. I wanted to also mention, I love your new rebrand.
So Maria, who's the director of operations, basically took it upon her about 4 months ago to change the website and rebrand it, and she did a wonderful job. So
Yeah.
this is, I don't know if it's in focus. So this is
Yeah.
CystoProtek,
Yeah.
and she changed the gentle derm as well.
Uh-huh. It looks
Again,
great.
keeping the same kind of colors. All the ingredients are the same. Price is the same. Just the look is a little different,
Mhm.
and it indicates also some of what we discussed. For
Mhm.
instance, it says liposomal
Mhm.
flavonoid.
Mhm.
For those who understand what liposomal means, that means it's mixed with oil to make it more absorbable. Some
Sure.
people know what liposomal means, some people don't.
Mhm.
It says flavonoid because it does have quercetin in it, and it
Mhm.
says bladder support. So basically, with 4 words, it gives a little more information than just CystoProtek, even though
Right.
it's been around for a while.
Mhm.
So what will be interesting is in the Allergy Protect, one of the ingredients that will be there has very good evidence for reducing basically neuropathic pain as well.
Mm.
So there's evidence that it blocks mast cells, but there's evidence that reduces neuropathic pain. And in fact, the International Association for the Study of Pain
Mhm.
asked me, and I made a little podcast, and it's actually permanently on their website about the involvement of mast cells in pain.
Mhm.
And I might send you the link for that, if you would
Yeah.
be interested.
Thank you.
So we're trying basically to catch 4 birds with one stone, so to speak. So
Yeah.
inhibit the mast cells, have antihistamine, break down the histamine, and also reduce the pain that might be associated with mast cell activation. So I think that would be a perfect additional supplement to CystoProtek,
Yes.
or
I'm
those with Vulvodynia for that matter.
This has been really, really a wonderful, eye-opening interview, and I love that we brought in Vulvodynia and discussed, the correlation between the two conditions because, again, I think a lot of people do struggle with both, and I don't think
Right,
people are aware of how many people do struggle with both, as well as, other conditions that you discuss, like chronic fatigue syndrome, fibromyalgia, irritable bowel syndrome, the whole gamut of syndromes, which is, very frustrating because a lot of
right,
doctors don't want to take these on because they're difficult to treat. So
right.
I commend you for your work.
Thank you.
And, I really appreciate what you do. And, I've had so much positive feedback from, your products. Like people have said, they got their lives back. So,
Thank you. Thank you
thank you
very
so
much.
much for what you do and for providing such incredible products to people who
Well,
are.
I hope, as we were talking before we went on air, that there will be some very good new research taking place in the next kind of 9 months or so.
Mhm.
So hopefully, by the time we're ready for a new episode, I will have actually new and exciting findings to share. But I will leave everybody with a hopeful message. Number one, we're trying to recreate the bladder area on a chip. So it's called human organoid on a chip. So we'll be using bladder cells and immune cells and nerve cells to recreate basically that area so we can study it better. And that will give us the springboard to understand if there can be objective markers for diagnosing as well as new targets for treatments.